The purpose of the circular scrub method of toothbrushing is to dislodge and remove bacterial plaque and debris from the surfaces of the teeth and the free gingiva. Multi-tufted soft toothbrushes should be used. The bristles are generally made of nylon, 6,000th to 9,000th inches in diameter, and 11/32 to 15/32 inches in length. There are 18 to 50 tufts in the brush, with 30 to 100 filaments in each tuft. The bristles have a resilient interaction as demonstrated with a dental probe. There is adequate space between the tufts of the bristles for cleaning the brush. The brush shown in this movie has longer bristles in the mid-portion and shorter bristles toward the edges. This, however, is not an essential feature of a multi-tufted toothbrush. The ends of the bristles are blunt to prevent injury to the gingival tissues during brushing. Note the resilient action of the bristles when tested with the finger. The toothbrush should be held in a firm and secure grip. However, one should be able to rotate the handle so that the brush can be easily directed toward the various surfaces of the teeth. The bristles of the brush are kept perpendicular to the surfaces of the teeth and the surrounding gingival tissues. They should extend 1 to 2 millimeters apical to the free gingival margin, but definitely not to the mucogingival line. The circular scrub movements of the toothbrush are demonstrated. The brush acts on 2 to 3 teeth at the same time. With a continuous circular scrubbing movement, the brush is slowly brought forward to engage new areas. The action of the brush is shown in detail in this close-up view. The main portion of the brush contacts the teeth rather than the gingival tissues. The marginal gingiva, however, should be included in the brushing, as demonstrated on the right posterior maxillary teeth of this model. The circular scrub movements are now demonstrated on the labial surface of the maxillary anterior teeth. The palatal aspect of the maxillary left molars is also brushed. In order to reach the palatal aspect of the maxillary anterior teeth, the brush must be placed in an anterior-posterior position, with only a part of the bristles participating in the active brushing. The occlusal surfaces should also be brushed with a circular scrub action. It is important to develop a sequential order of toothbrushing to assure complete coverage of all tooth surfaces. Start with the buccal aspect of the right maxillary molars. Move forward to the bicuspids, cuspids, and then the incisors. Change the position of the brush for the left incisors, cuspid, left bicuspids, and molars. Be sure that the brushing is extended behind the last molar. Then change over to the palatal aspect of the maxillary left molars and bicuspids. Note the change in brush position for access to the palatal aspect of the anterior teeth. The right bicuspids and molars are then brushed. The sequence is ended by brushing the occlusal surfaces. Brushing the mandibular teeth should start with the buccal surfaces of the right molars. Note the circular scrub action that is used. The brushing is extended forward to the bicuspids and cuspid. The position of the brush is changed for the mandibular anterior teeth. A correct position for brushing the lingual surface of the mandibular left molars is shown. The brushing is extended forward toward the bicuspids. The position of the brush is changed to gain access to the lingual surfaces of the lower anterior teeth. The brush is held in an anterior-posterior direction. The occlusal surfaces of the mandibular posterior teeth should be brushed separately. The sequence of brushing the mandibular teeth should begin with the distal buccal aspect of the last molar on the right side, moving forward to the bicuspids and then to the anterior teeth. The position of the brush is changed and moved from the left anterior to the posterior areas, ending at the distal buccal surface of the last mandibular left molar. Brushing is then performed on the lingual surface of the lower left molars and bicuspids with a change in brush position for the lingual aspect of the lower anterior teeth. The brush position is again changed to gain access to the bicuspids and molars. Finally, the occlusal surfaces of the posterior teeth are brushed. The circular scrub method will now be demonstrated on a patient. The same sequence of brushing that was shown on the typodont will be followed. Note the circular scrub movements of the brush and the blanching of the gingival tissues. The action of the bristles on the teeth and the gingiva is also demonstrated in the anterior region. Note the cleansing of the junction between the free gingiva and the teeth. This, from a periodontal standpoint, is the most critical area for plaque removal. The position of the brush and its action are now demonstrated on the palatal aspect of the left maxillary posterior teeth. The end of most bristles work against the dental-gingival junction in the palate, while a small part of the brush covers the adjacent palatal mucosa. Access to the palatal side of the anterior teeth can best be achieved by holding the brush in an anterior-posterior position and covering only one or two teeth at a time. Again, note the circular action that is used. Brushing the occlusal surfaces of the teeth is illustrated in the maxillary right quadrant. Care should be observed not to place too much pressure on the brush, or the tips of the bristles will not function well. The same circular scrub movements are demonstrated in the mandibular right quadrant. The position and movements of the brush when cleaning the labial aspect of the mandibular anterior teeth are shown in this scene. is important to hold the tongue out of the way so the brush can be positioned against the lingual surfaces of the mandibular molars. The brushing should extend to the marginal gingival tissues as lingual surfaces are cleaned. The proper brush position and action for cleaning the lingual surface of the mandibular incisors are demonstrated. Finally, brushing is completed by scrubbing the occlusal surfaces of the teeth with the same circular motion. The mouth should not be opened too wide when the toothbrush is inserted, or the lip muscles may become taut. Notice that when the mouth is partially closed, the lip muscles relax and the brush can be brought into proper position. The same principle applies for access to the buccal surfaces of the mandibular teeth. With the mouth wide open and the lip muscles taut, it is impossible to place the brush in the desired position. With the mouth opened less widely, the muscles are relaxed and the correct brushing position can be obtained. Some patients have a problem with involuntary contraction of their lip muscles when a toothbrush is inserted in the mouth. In this case, it is helpful to hold the lip with the fingers while the brush is positioned and the teeth are cleaned. Disclosing solution has been applied to the teeth. This is helpful in demonstrating how plaque is removed by proper toothbrushing. Plaque adheres tenaciously to the teeth and has to be dislodged by the mechanical action of the bristles. Detergent action of a dentifrice will not dislodge plaque unless it is broken up mechanically. A beautiful smile showing healthy teeth and gingiva is the ultimate reward for good oral hygiene. This method of toothbrushing, correctly employed, removes dental and intraclavicular plaque. This method includes both the use of the toothbrush and dental floss, but this film will demonstrate only the toothbrushing part of the Bass technique. A multi-tufted brush, such as Right Kind or similar type, is used. The tufts of the bristles should end in a slightly rounded tip, and the end of each bristle should be blunt. Note the separation between the bundles of bristles to facilitate cleaning the toothbrush. The bristles are resilient, and each bristle is about 7/1000th of an inch in diameter. The blunt end of the bristles is a safeguard against injury. The toothbrush should be held in a firm grip with all the fingers. The brush can be rotated in the hand to provide access to various areas of the mouth. Proper placement and action of the brush will now be demonstrated on the typodont. The brush is placed at approximately a 45-degree angle to the teeth, with the bristles pointing apically. Part of the brush covers the buccal surfaces of the teeth, while other bristles extend over the occlusal surfaces. The bristles penetrate into the gingival crevice, while the brush handle is being moved in small rotary or vibratory movements without actually changing positions of the tips of the individual bristles. Several teeth may be covered simultaneously by the brush, while it is gradually moved from one area of the dentition to another. Proper brush position and bristle action is illustrated in this close-up of the distal buccal aspect of the last maxillary molar. The correct position and action for cleaning the palatal surfaces of the maxillary molars and bicuspids is demonstrated. The position and action of the brush must be changed for the palatal side of the maxillary anterior teeth. The occlusal surfaces are partially cleaned while the buccal and lingual surfaces are brushed. But it is advisable to finish the brushing by directing the bristles into the occlusal surfaces with small vibratory movements. The following sequence is recommended for brushing the maxillary teeth. Start with the buccal surfaces of the maxillary right molars, moving up to the bicuspids, and then to the labial surfaces of the front teeth. Continue with the left front teeth and move to the buccal surfaces of the left maxillary bicuspids and molars. Change over to the palatal surface of the left maxillary molars, bicuspids, and palatal surfaces of the anterior teeth. Then move to the palatal surfaces of the right bicuspids and molars. Brushing the occlusal surfaces of the molars and bicuspids completes the cleaning of the maxillary teeth. The brush position for the buccal aspect of the mandibular posterior teeth is now demonstrated. Again, note how the bristles are placed into the gingival crevice. The brush is gradually moved forward, one tooth at a time. The position of the brush for cleaning the lingual aspects of the mandibular posterior teeth is shown. Again, note the vibratory movements that are used. In order to reach the lingual aspect of the mandibular anterior teeth, the brush must be placed in an anterior-posterior position with the bristles pointing into the gingival crevice. The brush should not be pulled forward as shown here, since this will prevent the bristles from entering the gingival crevice. When the brush is placed in the proper position, the bristles will enter the gingival crevices and at the same time clean the teeth. The sequence of brushing the mandibular teeth is as follows. Start with the buccal aspect of the mandibular molars and bicuspids on the right side. Move forward to the anterior teeth. Then shift to the left anterior teeth, bicuspids and molars. Switch over to the lingual aspect of the left molars, bicuspids, and the lingual aspect of the anterior teeth. Finish with the lingual aspect of the lower right bicuspids and molars. Then brush the occlusal surfaces of the mandibular posterior teeth. The Bass method of toothbrushing will now be demonstrated on a patient. Brushing is started at the buccal aspect of the right maxillary molars. The brush is first placed on the teeth and the bristles allowed to slide into the gingival crevice. Small vibratory movements are made. Note the blanching of the gingival tissues in response to the pressure of the ends of the bristles. In order to clean an area of gingival recession, it may be necessary to change the position of the brush so the bristles can be worked into the gingival crevice and clean the entire exposed tooth surface. As a result of previous faulty toothbrushing, this patient has experienced some gingival recession. In spite of the rigorous but faulty toothbrushing, she has not been able to keep her teeth free of plaque. Areas of gingival recession and irregularities of gingival contour may require special modifications of toothbrushing in order to accomplish complete plaque removal. Brushing of maxillary molars and bicuspids on the palatal side will now be demonstrated. Note how the bristles are placed into the gingival crevice with the resultant blanching of the gingival tissues. This is the proper brush position for cleaning the palatal aspect of the maxillary anterior teeth. If an anterior pull is made on the brush, the teeth and the gingival crevice will not be adequately cleaned. Observe the different action of the bristles when the brush is used correctly without pulling the handle forward. Finally, the occlusal surfaces of the maxillary posterior teeth are brushed. As previously demonstrated on the model, the bristles are directed into the occlusal surfaces with small vibratory movements. The brush position and action for cleaning the buccal aspects of the mandibular molars and bicuspids will now be demonstrated. Note how the bristles enter into the gingival crevice and remove the plaque at the cervical areas of the teeth. Brushing is extended to the anterior teeth using vibratory movements. It is important that the brush is placed in the correct position to reach into the gingival crevice on the lingual aspect of the posterior mandibular teeth without interference from the tongue. The bristle should also be directed into the gingival crevice on the lingual aspect of the mandibular anterior teeth. The brush should not be pulled forward because the bristles will bend and cannot enter the gingival crevice. Proper action of the brush may also be achieved with the lower incisor teeth separating the bristles, as long as the bristles are allowed to enter into the gingival crevice. Brushing the occlusal surfaces of the lower posterior teeth is now demonstrated. This patient has not maintained oral hygiene for 4 days in order to demonstrate patterns of plaque formation and plaque removal. Disclosing solution has been applied to the teeth. Note the heavy plaque formation on all teeth at the gingival margin. The plaque adheres tenaciously to the surfaces of the teeth, and considerable effort is required to remove it. The brush position and action for cleaning the maxillary posterior teeth are demonstrated. Also note the brush action on the left cuspid and bicuspid. In order to remove the plaque in the area of gingival recession over the cuspid and first bicuspid, the toothbrush is placed in a modified position, allowing the bristles to work on the tooth surface and to enter the clavicular areas corresponding to the recession. The action of the toothbrush upon the plaque is seen on the buccal aspect of the posterior mandibular teeth on the right side. Note that in spite of considerable effort, there is still some residual plaque, indicating the need for further brushing. The Bass method of toothbrushing is one of several acceptable methods for maintaining clean teeth and good oral hygiene.